This video was produced to prepare physiotherapists for the interviews on stratified care in Nigeria. It is the first of a two-part video focusing on the introduction and rationale for the start-back approach, while the second part to follow focuses on research evidence and benefits of the start-back approach. It is a collaboratory effort from the Trier University of Applied Sciences, Germany, the University of Lübeck, Germany, and the Obafemi Awolowo University in Nigeria. The start-back approach in this video was developed in the School of Medicine, Keele University, UK. This video was designed to describe the rationale for start-back approach to low back pain, to describe the psychological barriers to treatment progress, and to introduce the start-back approach. Non-specific low back pain is highly prevalent and debilitating today, resulting in high treatment cost and low quality of life. Despite current treatment approaches, outcomes are suboptimal and levels of disability remain high. Studies have shown that there are some challenges with the current approach to treatment. First, it is based on intuition of clinicians. This is not always 100% reliable. Second, treatment needs diagnosis. Since most cases are non-specific, expensive diagnosis gives no added advantage. Third, all patients are given similar treatment, a one-size-fits-all approach. From research, we know that not all patients need physiotherapy. Current treatment encourages passivity, saying you can get better with more treatments. This leads to over-dependence on physiotherapy and reduce patients' participation in their treatment. Thus, we need a new approach because no two patients are the same. Also, many factors contribute to patients' low back pain perception that needs to be addressed. There are identifiable risk factors that contribute to worsening condition and are often ignored. We know from research that these risk factors can be little or very strong. Among them are psychosocial risk factors. They can have a reasonably large influence on low back pain. They include catastrophizing, fear avoidance, somatization, depression, and distress. Ideas and behaviors like trying to find a spinal defect causing the pain, taking bed rest and avoiding activity for fear of pain, worrying and negative thoughts have been shown to reduce outcome and are not considered in current treatment approach. The start-back approach, however, is based on a transition from one-size-fits-all approach to a stratified approach where patients are grouped based on risk of chronicity and treatments are targeted to these subgroups. It involves screening patients based on a likelihood of poor treatment outcome and targeting specific evidence-based treatments to these subgroups. The classification is done using Start-Back tool, a questionnaire which screens patients into 3 subgroups. The questionnaire was developed in the UK. It consists of 9 questions. The first 4 questions reflect physical characteristics, while the last 5 questions reflect psychological characteristics. The questionnaire is simple and short and can be filled under 1 minute. An individual who scores 0 to 3 will be grouped as low risk, 4 or more medium risk, and 4 or more on the subscale as high risk subgroup. The low-risk subgroup is made up of patients who will do well with little or no intervention. The medium-risk subgroup consists of patients with average to moderate likelihood of poor treatment outcome. These patients have lesser physical and psychological components of pain. And the high risk with high likelihood of poor treatment outcome. These patients need more care due to the presence of physical and psychological components of pain. In the start-back approach, all individuals visiting the clinician with varying forms of non-specific low back pain are first screened using the 9-item start-back questionnaire. The score determines the subgroup classification. Depending on the subgroup an individual falls into, there are matched treatment recommendations. Patients are matched with treatments based on these recommendations. For low risk, advice and pain medication. Medium risk, physiotherapy and self-management. For high risk, physical and psychological approach. Summarily, psychological risk factors present in low back pain cases can hinder patient recovery and are often ignored. The Start Back approach uses the Start Back questionnaire and its matched treatments. Patients with non-specific low back pain are grouped based on risk into 3 subgroups. Evidence-based treatment recommendations are given to patients in each subgroup.